welcome to Dealing with Dementia. My name is Dr. Eric Freitag. I'm a licensed psychologist, board-certified neuropsychologist, and an expert in the diagnosis and treatment of dementia. In today's Dealing with Dementia video, I will provide some basic information on dementia to help you gain a better understanding of how dementia is diagnosed and steps that you can take to help a family member or a loved one obtain a proper diagnosis and support for this condition. Dementia is a general or umbrella term that describes a neurological condition that affects how the brain functions. An individual with dementia will show declines in areas such as memory, decision-making, and general thinking skills. Most dementias are progressive, meaning that they will get worse over time. There are many different types of dementia. In fact, there are over 100 different types of dementia diagnoses. Alzheimer's is a type of dementia, and in fact, it is by far the most common type of dementia, comprising of nearly 60% of all dementia cases. However, there are also other common dementia conditions, such as vascular dementia, Lewy body dementia, frontotemporal dementia, to name a few. In future videos, I will go into greater detail describing these different dementia conditions. Dementia is a clinical diagnosis that is made when a patient demonstrates conclusive signs and symptoms that are consistent with the specific dementia condition and other potential contributing causes have been ruled out or excluded as being a primary cause of an individual's decline in mental abilities. There is not one single test or medical study that can be performed that can confirm a diagnosis of dementia. Rather, a diagnosis is made when a number of clinical factors are consistent with the typical signs and symptoms of a dementia diagnosis. A dementia diagnosis can fall under three categories of certainty. A possible diagnosis is made when there are some factors, such as the patient's history, that are suggestive of dementia. A probable diagnosis is when multiple patient factors and data, such as a patient's history, medical conditions, brain imaging, and neuropsychological test data, are consistent with the suspected dementia pathology. Research has supported that probable clinical diagnostic findings of dementia are often accurate greater than 90% of the time. A definitive diagnosis is only obtained on autopsy or in the rare circumstances of brain biopsy. A common question that is asked, how do I know if a loved one has dementia or is exhibiting just normal age-related declines in memory? Clinically, dementia is diagnosed when there are objective findings of declines in cognitive functioning that is determined by neuropsychological testing. These declines in cognition then cause changes in declining abilities to function in everyday life. So, for individuals that may have concerns about decline in memory, we would not be too worried about someone who occasionally forgets where they put their keys. However, if increasing forgetfulness and difficulties in functioning cause significant challenges in managing one's day-to-day activities, this is a strong indicator that they should have a comprehensive evaluation of their cognitive abilities. If you have concerns that a loved one may be exhibiting signs or symptoms of dementia, it is important to obtain a medical evaluation as early as possible. The earlier we are able to identify what is going on and initiate treatment, the more things can be done to preserve functioning, well-being, and quality of life. The first step is to contact your primary care doctor and have a thorough medical evaluation to rule out any contributing medical causes. A referral to a neuropsychologist is then an important next step. A neuropsychologist will evaluate brain functioning and how one's cognition impacts their behavior and abilities to function on a day-to-day basis. This information is especially valuable to not only determine what is going on and formulate a diagnosis, but also to provide recommendations for care and treatment that is tailored and specific to that patient. I want to again emphasize the importance of obtaining an evaluation as early as possible. While there is no cure for dementia, there are treatments, interventions, and management strategies that can be implemented that can provide the patient with information to function as best as possible. In future videos, I will specifically address some of these treatment and management strategies. Thank you for watching this Dealing with Dementia video. Please subscribe and hit the like button so that you can be notified of future videos. Please feel free to leave comments below or email me at efreetag@wecare-sla.com. Until next time, be healthy.